we're going to go ahead and get started tonight. My name is Sarah Johnson, and I'm the Director of Janesville Mobilizing for Change. Welcome to the Hedberg Public Library and tonight's Candidate Forum focused on healthy communities. We are very pleased to be providing you, the voters, a forum where you can hear from your legislative candidates on the health issues that are most important to you. Before we begin, I'd like to take this opportunity to thank a few people. First, I would like to thank all of the sponsoring coalitions that helped make tonight possible. Janesville Mobilizing for Change, the Edgerton Coalition for a Healthy Community, Building a Safer Evansville, Youth to Youth, and the Milton Youth Coalition. All of these groups in Rock County have been formed as grassroots efforts to address health issues in their communities. More information about each one of these groups can be found at the tables in the back of the room. Thank you to the Hedberg Public Library for providing tonight's meeting room, and thank you to Best Events for providing the table coverings and the beautiful flowers. Next, I'd like to thank all of the candidates for taking the time out of their busy schedules to be with us this evening. I want to personally thank Janet Labrie for moderating tonight's forum, and I'll be introducing her later. And lastly, thanks to all of you, the voters, for taking time out tonight and making this event successful through your participation. We will begin tonight's event with a series of brief presentations on the issues and topics of tobacco, alcohol, and heroin. You are welcome to jot down any questions you would like to ask of our candidates regarding healthy communities on the note cards that we provided at the welcome table. You're welcome to grab some more if you think of other questions during the presentations. We will be collecting cards after the presentations, and we will try to get as many questions in as possible in the short amount of time that we have. So we're going to begin our evening. Thank you.
Good evening. My name is Megge Casique. I am a prevention specialist with Youth to Youth for Change in Beloit, and I will be giving a brief presentation on tobacco in Rock County and in the state of Wisconsin. Each year, 4,700 kids under the age of 18 become new daily smokers, and 7,700 people die from tobacco-related deaths in Wisconsin, and about 10% of those deaths are related to secondhand smoke. This is equal to wiping out the entire city of Edgerton and an additional 2,000 people. That's thousands of children losing a parent, many mothers and fathers losing a child, and numerous loved ones losing a friend. These deaths and losses are 100% preventable. Despite all the work that has been done in tobacco prevention and control, and the great strides we have made, tobacco is still the #1 cause of preventable death in our state. Not only does tobacco take lives permanently, affecting families and friends of smokers and those exposed to secondhand smoke, it also costs every Wisconsin resident $785. The total economic toll of tobacco in Wisconsin is $4.5 billion per year. Of this number, $2.8 billion goes toward annual health care costs caused by smoking and $1.7 billion in lost productivity. The tobacco industry spends approximately $146 million in marketing in Wisconsin each year and has many resources to keep users hooked and to target potential customers. We need all the means possible to protect our kids and Wisconsinites from the harms of tobacco. The Center for Disease Control and Prevention recommends we fund our state program at $57 million. Currently, Wisconsin invests less than 10% of what the CDC recommends. In Wisconsin, annual tax collections from smokers total more than $645 million, but less than 1% of that is dedicated to help smokers quit and prevent youth from starting. The revenue collected from cigarette taxes in Wisconsin in 1 year could fund tobacco prevention in the state at the recommended level of funding for 11 years. As of July 5th, 2014, we celebrated our 4-year anniversary of smoke-free air in the state of Wisconsin. However, the rising popularity of e-cigarettes threatens Rock County's clean indoor air. As cigarette smoking rates have dropped, the tobacco industry has gotten into the e-cigarette business. E-cigarettes are being marketed as healthy, guilt-free alternatives to smoking. However, there is no scientific evidence to support this. Additionally, despite many manufacturers' claims that these e-cigarettes are a tool for quitting, to our knowledge, not one company has applied or has been labeled a proven cessation device by the FDA. These products are marketed to kids. Candy flavors, easy online, and kiosk access, and glamorous marketing to our kids. E-cigarettes could lead to the renormalization and social acceptability of smoking traditional cigarettes, undermining the decades of hard work we have done to decrease tobacco use and keep our kids healthy. The industry continues to develop new innovative ways to addict people, especially our kids. Other tobacco products on the market right now include little cigars that look like cigarettes but are significantly cheaper and come in any number of kid-friendly flavors such as grape, banana split, and gummy bears. 42% of kids who smoke cigars or cigarettes report using methanol, candy, and fruit-flavored tobacco products. These products are cheap because little cigars are wrapped in brown paper. They are classified as other tobacco products and are taxed at a much lower rate than cigarettes. This tax loophole makes fruit-flavored little cigars cheaper and more accessible to youth. Tobacco is still the #1 cause of preventable death, but together we can change that. Thank you.
Hello everyone. My name is Meagan Farrell and I'm with the Edgerton Coalition for a Healthy Community.
And my name is Jennifer Braun and I'm with Building a Safer Evansville.
We are here today to share a short presentation on alcohol misuse and how it affects everyone living in our communities and the state, and what needs to happen in the future to make sure we change Wisconsin's alcohol culture and reduce the burden of excessive alcohol use. Wisconsin is the 20th most populated state, but has the 3rd highest total alcohol consumption in the country. Wisconsin ranks highest among all states in binge drinking, 50% above the national average. Binge drinking is an important risk factor for alcohol-related injuries and death. Binge drinking is defined as 5+ drinks for men, 4+ for a woman in one occasion. But binge drinking isn't the only way Wisconsin leads the country in alcohol misuse. When it comes to underage drinking, Wisconsin has one of the highest rates. 41% of Wisconsin high school kids reported that they had a drink in the past 30 days. 25% reported binge drinking. In 2014, 26% of Rock County high school students reported drinking alcohol in the past 30 days, compared to 38% in 2012. That's a 12 percentage point decrease in 2 years. Our underage drinking rates have begun to decrease thanks to local efforts across the county. We have 4 drug-free community grantees, one in Beloit, one in Janesville, one in Evansville, and one in Edgerton, that focus on reducing underage drinking. In the past 7 years, $1.8 million has been spent in Rock County alone towards these efforts, but there is still much work that needs to be done. Wisconsin has the highest drunk driving rate in the country. In 2011, excessive alcohol consumption contributed to at least 5,750 motor vehicle crashes. Motor vehicle costs related to alcohol misuse cost our state $418 million a year. However, excessive alcohol use expenses go beyond our pocketbooks. In 2012, alcohol-related crashes killed 223 people in Wisconsin and injured nearly 3,000. Approximately 36% of all fatal traffic crashes in Wisconsin in 2012 were alcohol-related. For too many youth and adults in Wisconsin, the chance to live healthy lives is complicated by alcohol misuse. Jen is now going to talk about 2 proven strategies to reduce alcohol misuse in our state. These strategies have been shown to save lives, save economic costs, and promote public safety.
The first strategy I'm going to talk about is the underage drinking, the drinking age of 21. Wisconsin isn't in the norm. Only Wisconsin and 3 other states allow parents to purchase alcohol for their child under 21 to consume at a licensed premise, like a bar or a restaurant. If we are taking kids to bars and telling them it is okay to underage drink, if your parent is with you, it is setting a social standard that the drinking age of 21 does not matter. Plenty of scientific data exists to support a drinking age of 21. Because the brain is not fully developed, alcohol use prior to age 21 can hamper brain development and function. Also, youth who drink are more likely to have school problems, such as higher absence rates and poor or failing grades. Alcohol use also puts kids at a greater risk for injury and impact reaction times and endurance for sports. Youth who begin drinking before the age of 15 are 4 times more likely to develop alcohol dependence than those who begin drinking at the age of 21. A consistent drinking age helps make the point that underage drinking isn't okay. The second strategy we're going to talk about is alcohol tax. Excessive alcohol consumption costs the state $6.8 billion a year, yet alcohol taxes have not been raised in decades. Wisconsin is currently 48th nationally in beer tax, 42nd in wine tax, and 36th in distilled spirits tax. For every dollar currently generated in alcohol tax revenue, taxpayers and businesses pay over $100 in healthcare costs and lost productivity costs. Currently, no state funding goes towards programs aimed at alcohol misuse and treating alcohol addiction. Increasing alcohol taxes can have many benefits. Wisconsin could lower their binge drinking rates and underage drinking rates. Minors are especially sensitive to higher taxes and higher costs. An increased tax would also lower alcohol-related injuries, and the revenue generated could go towards prevention, enforcement, and treatment funds.
And last but not certainly least, I'm going to talk about Rock County's heroin epidemic. Heroin is generally thought of as a problem confined to big cities, dark alleys, and desperate people. However, heroin has found a new foothold in our state's small towns and suburban communities. And its victims aren't hardened addicts either. They're teens and young adults from all walks of life. Heroin does not discriminate. It claims men and women, old and young, every color and nationality, rich, poor, or anywhere in between. Heroin is an illegal and highly addictive drug that can be smoked, sniffed, or injected directly into the bloodstream. Many heroin users begin their addiction by misusing prescription painkillers, which are chemically similar to heroin, both in the opiate classification. Prescription drugs are the most commonly used illegal substance among teens besides marijuana. A lot of work has gone into making prescription drugs more difficult to obtain and abuse. With heroin being inexpensive, only $10 to $20 on the streets, and easy to obtain due to Rock County's location on the drug trafficking route between Chicago and Minneapolis, we definitely have a problem. As you can see from the picture in the upper corner, heroin is a small product that's easy to transport without detection. This makes our law enforcement's job even harder. Despite this difficulty, we have seen an increase in heroin cases submitted to the state crime lab. The numbers reveal a growing epidemic. The number of heroin cases processed by the state crime lab has increased steadily in almost every Wisconsin county throughout the last 3 years. I know this map from the Wisconsin Department of Justice is small, but Rock County is seen in red on this map due to our high number of cases. In 2010, our law enforcement agencies across Rock County submitted 30 cases. This increased to 43 in 2013. Heroin and prescription painkillers are killing our citizens. These numbers were provided by the Rock County Coroner's Office and show a dramatic increase in opiate-related deaths from 16 in 2006 to 64 in 2012. Numbers from 2013 and 2014 have not yet been finalized. They do indicate a lower number of deaths, but that does not mean we have less use. In fact, in 2013, while we anticipate final results showing 20 deaths, our EMTs and paramedics across Rock County administered 137 doses of Narcan. Narcan is a drug that reverses the effects of an opiate overdose and saves lives. Not only is heroin killing people, it's costing us a lot of money too. A study done in the year of 2001 estimated that the economic cost of heroin in Wisconsin is $220 million a year. Again, that was 2001, so only imagine what that cost has increased to today. We are seeing heroin cause an increase in emergency room visits, crime, homicides, high school dropouts, loss of employment, HIV and hepatitis cases, and child protective service cases. Just an example to demonstrate a small part of the cost of heroin, I spoke with one of Janesville's police officers, and he explained a typical response to a heroin overdose call, or an opiate overdose call. Generally, 2 patrol officers respond immediately, along with a minimum of 2 paramedics. The paramedics administer care and take the overdose victim to the local emergency room, where a team of nurses and doctors administer care and stabilize them. Meanwhile, a couple of Janesville street crime officers will be called to the scene, where they'll spend an average of 3 hours searching and securing the scene and conducting interviews. The Janesville Police Department has assigned an officer to follow up with the addict in an attempt to encourage them to engage in treatment. Rock County Human Services currently provides assessment and treatment options for addicts, including heroin addicts. The less expensive outcome in this story is that the addict engages in treatment and eventually recovers. The more expensive version includes continued use, increased of all those other events, and possibly a repeat overdose. Now, multiply that by the 25 overdose calls Janesville Police Department alone has been called to this year, add in all of the other counties and communities in Rock County, and then add in the rest of the state, and you can see why we have a costly problem. Hope is not lost. The Wisconsin State Council on Alcohol and Other Drug Abuse, also known as SCAOTA, Prevention Committee, formed an ad hoc committee recently to address the heroin issue. A panel of experts from across Wisconsin from a variety of fields spent significant time researching the issue and proven strategies to combat this epidemic. In July of this year, they released a strategies and solutions report which outlines specific steps that can be taken in the 5 domains of prevention, harm reduction, treatment, law enforcement, and in the workplace. Some of these strategies are currently being implemented here in Rock County, and plans are being laid to implement others. Getting into these details would take longer than my allotted time, but I'm happy to discuss this issue further with anyone who's interested. This report is available on the SCAOTA website or by speaking with me after the forum.